Hey everybody, it's Shannon from AMA, and today I'm going to talk to you guys about some of our body treatments that we have here at the spa. The two that we're going to feature right now is our carboxy treatment, which is commonly used for skin tightening. We use it for a lot of textural treatments such as cellulite, which is a really big one. So we're using it in a lot of different areas on the body. Probably the most common that people are coming in for is the fronts of the legs, the back of the legs, the buttocks, but this can also be used on arms, abdominal regions to just help to tighten up that skin, anything that's looking really crepey, but we can also help to really pop out those indentations. Essentially the carboxy machine, it's hooked up, we have tubing, and that tiny tubing is connected to a needle which slips underneath the skin. And what happens is as the gas goes through, it's filtered, and it almost creates a popcorn effect underneath the skin. So we'll show that in just a bit. But that's going to be really great for that smoothing out and evenness of the tone of the skin. When we talk about tone, our biggest treatment for toning is our Emsculpt device. What it is it is a treatment that we are able to use on different areas of the bodies. Right now I have hooked up the panels that we put on the buttocks. These applicators are also used in the abdominal area, and what happens is as the machine starts, there is a automatic reflex that happens to the muscle that we're trying to target. So essentially, without trying, your butt muscle is going to start to contract, and we can hit different target areas on the butt. We'll also do areas of the abdomen. We can treat other regions. So common spots that we have is the arms. We'll do the biceps, we'll do the triceps, we do calves, but there are other areas as well that we're able to hook up. So please call at any point. You can ask to set up a consultation with any of us providers and we can educate you a little bit more. All right, you guys, so right now we're gonna show you the Emsculpt. This is that treatment where basically you feel like you're at the gym without even trying, no pain, no soreness. Involuntarily, your muscles are gonna just start to contract. So we're able to treat multiple areas on the body. Right now we're showing the booty. So the butt muscle is one of the greatest, largest muscles, and it's really key for some strength and support in through the back. And what happens is Emsculpt is actually causing supramaximal contractions of the muscle. So like I said, without trying, it's just going to contract. But you can try and squeeze, squeeze, squeeze as hard as you can at the gym, but you're only allowed to produce so much of a muscle response. With this, it's forcing those responses and contractions. So if you look, you can actually see the panels almost, giving you that vibration, and you'll actually watch the butt muscle rise up and down as each contraction is delivered. So in every single treatment, you're actually getting 20,000 supramaximal contractions. In essence, a way that some people say, oh my God, it's like you're doing 20,000 squats in a treatment. Basically, right? But there's no pain, clearly. It's a weird sensation. To some people, it feels like almost like little spankings or like a little vibrotic along the butt, but it's really great, and you should definitely come in and try it. Usually what we'll try and do is do a series of treatments. You want to space those treatments. You can come in as much as twice a week or every other day for treatment. And once we get the results that you're looking for, then you can always ask us about maintenance and how frequent one should come in. But stay tuned for some before and afters. So right now what's happening is these are short, quick delivered contractions. So in portions of the treatment, there's long contractions and then there's some short contractions. And the reason that we switch it up is because we're trying to target different muscles of the buttocks. So it'll go through a couple different breaks. And some people like this portion because it feels like they're getting a little bit of a rest. They're not as, I hate to use the word intense because none of this whatsoever is intense. But when it does that first long pulse, it's just so bizarre. Almost to the point where you want to laugh, which is totally fine. But some people, they'll actually turn off the lights and close their eyes and it's nothing at all. It's definitely weird getting used to, but I can definitely say once you start doing these treatments, you're gonna feel stronger. Not only in just everyday life, but you'll definitely feel a lot stronger in your clothes, you'll feel strong at the gym, just because everything feels so much more toned, so much more tight, which is awesome. All right, you guys, here's that popcorn effect that we're looking for. Let's see if we can see it again, because just a moment. You are really watching it rush in. We're gonna start to see this tissue bubble up. There it goes. All right, so it's starting to really fill. And you can watch it go into the problem areas. You'll see some redness form. She's definitely feeling some stinging. So I'm gonna try and now be a little more generous to her. So this padding definitely helps with that irritation. But again, up close you can see it traveling all throughout that region, which is great, okay? Once we know that we've gotten a good fill in a region, we can move it and go to another area that we've previously marked. And we have pictures to definitely see our landmark area. So a lot of times you just mark with white pencil. That's an easy way, unless you've been working with a patient for forever. Then you just know their sweet spots. But it's always helpful to do a little marking there. And again, you can just cover all bases. So again, here it is. We're gonna see the starting point, and you're gonna start to see it fan out. And sometimes it'll move inward towards that medial thigh, and then sometimes it's just going to travel upwards or travel down. Occasionally people will feel that carbon dioxide gas shoot all the way down towards the knee. If there's areas of, of problem, then it's just going to start to fill on its own there. And again, not always, even though I can feel it underneath my hand, I can feel that gas traveling. You're not always going to see the popcorn, but it's common, especially in the beginning. You'll see a lot more of that. So thanks for watching.